Hello everyone, I'm Seung working in Busan National University Yangsan Hospital. It's a great honor to present about my study in the ICUrology video clips. This study is focused on natural history of small renal mass. As you can see, the title is Gross Kinetics of Small Renal Mass, Initial Analysis of Active Surveillance Registry. It is about natural history of small renal mass, especially gross kinetics and clinical progression. We conducted this study prospectively after IRB approval because the active surveillance was not proved at the beginning of this study. But nowadays, the active surveillance without initial active treatment is proved. Several large prospective studies in the Western countries. So several guidelines are recommended as an alternative treatment option for small renal mass. Before this study, we have to know several points about the small renal mass. The first one is small renal mass has a very slow growth rate. In our research, some small renal mass have not changed in size over the years. So we can delay the active treatment if we can select optimal candidate. The second one is the clinical progression, especially early metastasis, is extremely rare when their size is small. The third one is inaccuracy of imaging diagnosis and the high probability of benign tumor when their size is small. We have to know about these points. For this study, we prospectively collected the follow-up data of small renal mass in our hospital. The aim of this study is to evaluate the difference between not progressed small renal mass and the progressed small renal mass. So we can suggest the appropriate active surveillance candidate among the small renal mass. This study is conducted 2010 to 2016. Overall, 37 patients were enrolled. All small renal mass is smaller than 3 centimeters. Indication of active innervation are growth rate more than 5 millimeters per year, or the diameter is more than 4 centimeters, or the clinical progression such as early metastasis, or in addition, whenever the patients wanted, they could give the active treatment. Table 1 shows the difference of patients' characteristics between the progressed small renal mass and not progressed small renal mass. As you can see, the only difference is growth rate. The figure 1 shows growth rate in both groups. As you can see, the growth rate is more than 5 millimeters in all progressed small renal masses. In conclusion, for incidental small renal mass, we can recommend active surveillance as an alternative treatment options to active intervention, such as partial laparotomy or ablations. And the only one difference between the progressed small renal mass and not progressed small renal mass is growth rate. The average growth rate of not progressed small renal mass is 1 millimeter per year, but the average growth rate of progressed small renal mass is 10 millimeters per year. So we can suggest the rapid growth rate is represent malignant potentials of small renal mass better than other parameters such as initial size. And finally, the renal biopsy could be helpful for decision of treatment options for small renal mass. So we have to do another study in the future. Thank you very much again.